Hi and welcome to Nutrition.com. Today we will be discussing a breakthrough finding, which can help you lose your stubborn fat. Stay tuned till the end. The latest research shows that if a person's uric acid levels are high, not as high to be classified as gout, but still in higher range, they are less likely to lose weight even if they try. Uric acid has been found to pack on body fat. For most of us, if we've heard of uric acid at all, it's only in relation to gout, a painful form of arthritis that occurs when uric acid builds up in the blood and forms tiny, needle-like crystals. But there's a new reason to care about uric acid. Scientists have discovered that nearly everyone over the age of 45 harbors elevated levels. And those high levels can cause hidden damage inside the body, long before gout pain surfaces. The good news is that it's easy to lower uric acid, and when you do, weight loss becomes easier than it's been in years. The average woman's uric acid level has risen 71% in the past 100 years, asserts David Perlmutter, MD, author of the New York Times bestseller Drop Acid. Leading scientists suspect that uric acid is at the root of the obesity epidemic and other health challenges, including diabetes, high blood pressure, fatty liver, and body-wide inflammation. The old way of thinking about uric acid: historically, doctors only thought about uric acid in two ways: the normal amount that the body produces and excretes, and the high amount that builds up and causes painful conditions such as gout or kidney stones. As a neurologist, Dr. Perlmutter began researching the link between uric acid and dementia. He found, even levels which most doctors would say are fine are significantly associated with declining health. This revelation changed his view of health and weight loss forever. Dr. Perlmutter discovered, as uric acid levels rise, so do BMI and waist measurements. In one study, folks with lower acid levels had waists that were 4 inches slimmer, on average. And 90% of overweight people with hypertension have high uric acid, according to a study in the Journal of the American Medical Association. Also, menopausal women are at a dramatically higher risk of high uric acid, since estrogen provides a layer of protection when we're younger. How uric acid drives weight gain? According to Dr. Perlmutter, metabolic problems begin to brew when uric acid reaches a level of 5.5 mg/dl, even though gout doesn't form until levels reach around 7 mg/dl. Why uric acid is a bigger problem now than in years past? Modern diets are filled with acid-stimulating fructose. He's not talking about the natural kind found in fruit, but the processed form that goes by names like high fructose corn syrup. All this refined fructose generates uric acid, turning our fat switch on so we store pounds like a bear ready to hibernate. Richard J. Johnson, MD, author of The Sugar Fix, contends, refined fructose is metabolic poison. That's concerning since the average American consumes 57 pounds of sugar each year. Benefits of lowering uric acid? When you lower uric acid, whole body healing quickly follows. There's no question people will lose a substantial amount of weight, says Dr. Perlmutter, who has seen patients shed 15 pounds and reduce uric acid levels by 10% in 3 weeks. And 85% of his test cases restored their blood pressure to healthy ranges. How to know if you need to lower your levels? If you eat refined fructose, also known as high fructose corn syrup, found in most packaged foods, or are battling stubborn pounds or symptoms of metabolic syndrome like high blood pressure or blood sugar, you can benefit from lowering your acid levels. To figure out your uric acid levels, you can ask your doctor for a routine blood test to screen for uric acid. How to lower uric acid levels naturally? Make easy diet changes. Uric acid comes from only 3 sources: refined fructose, alcohol, and meat. On the plan, you'll avoid those 3 culprits and opt for mostly plant-based meals and snacks containing fruit like apples, citrus and kiwi, cruciferous veggies like broccoli, beans and legumes, eggs, nuts and seeds, small amounts of dairy, and extra virgin olive oil. You can also enjoy 4 to 6 ounces of meat and fish twice a week. Be sure to avoid refined carbs, refined fructose, and artificial sweeteners. And since uric acid triggers inflammation, highly processed vegetable oils and gluten, which inflame the system, are also off the menu. These 3 superfoods can help along the way. 1. Tart cherries lower uric acid. These treats are rich in healing plant compounds that are proven to dial down uric acid-related inflammation. Eating half cup of tart cherries daily reduces gout flare-ups by 35%. 2. Broccoli sprouts lower uric acid. Cruciferous vegetables, especially broccoli sprouts, contain a molecule that creates sulforaphane, a compound that's known to reduce uric acid. To get the perks, strive for 3 ounces daily, chewed thoroughly. 3. Coffee reduces uric acid. Sipping just 16 ounces daily of Java cuts metabolism, slowing diabetes risk by 54% and lowers the risk of gout by 24%. Hence, these were some interesting facts and findings about the link between weight gain and uric acid. So if you are struggling to lose weight, then it will be a good idea to consult your doctor and get your uric acid checked. If that is more than 5.5 mg/dl range, then try lowering that first to manage your uric acid levels as well as your weight. Hope you liked this and it was new finding for you. Please subscribe to my channel for latest updates about nutrition and health.